All right.
Hello,
Hi.
how are
Thank you
you?
for good. How are you?
I'm good.
So just before I'll just introduce myself. Thank you so much. But I'm Isha. I'm the communications coordinator for the ACLU of Delaware. And so that's just for people who didn't already know. But I'll let you introduce yourself, and then we'll kind of get our conversation started.
Yeah, no, my name is Shanae Darby. I'm with the founder and executive director for Black Mothers in Power. I don't know how deep we want to go into my introductions. I know some of the questions tonight will answer some of that. But our main focus is addressing Black maternal health care disparities in the state of Delaware through community programs. So we have doula training programs. We open up the center. So we're doing things like community organizing. We're getting legislation passed. So, January 1, Medicaid covers doula services now, right? So we're doing a lot of exciting work. We have a lot of things in the future that will come true. We're going to speak it into existence, between birth centers, transitional housing, getting more people to be trained as doulas. So that's like the work that we're doing in Delaware.
Yeah, thank you. And it's all really amazing work. And I'm excited to get your perspective on some of the kind of current issues regarding abortion in Delaware and reproductive care as a whole. So basically, I guess I'll just start off maybe by asking you this first question, which is why abortion rights are technically a racial justice issue, and what it means to kind of fight for abortion access intersectionally. Like, what does that truly mean when we're actually moving forward and hoping to protect that access?
Right. So abortion rights is healthcare. It is important when we're having these conversations and thinking about intersectionality, because a lot of times we fight for the right for abortion, but then when we think about like the justice part of it, it's like we can have the right to abortion, but what does that really mean for access, for pay, for being able to, like, all of those barriers, childcare, taking off of work, like all of those barriers that a lot of people are facing, low income Black and brown communities, to actually have the right to even have access to that right. Right. So when we talk about intersectionality, we're talking about those things. Like, how do we look at this in a holistic concept of abortion rights? And specifically, when we look at the state of Delaware, a lot of the conversation that we're having, I know we're going to talk about HB 110, some other things, great things have happened around just talking about abortion care, abortion rights here in the state of Delaware. And I feel like I'm like so proud, like around this specific issue when we talk about abortion rights, to be from Delaware, because I feel like we get it, we got this right. If nothing else, I feel like we get this right.
Yeah. Well, it's helpful that you kind of mentioned HB 110 a little bit, but this conversation is really timely, right? Because Monday was what would have been the 51st anniversary of Roe v. Wade, which nationally was overturned, but like you said, Delaware has kind of codified that. And so basically with HB 110, it is kind of looking to create that intersectionality, right? That continuing or creating that further access through ensuring people on different health insurance plans and things are able to access care regardless of their financial situation. So that's so true in that it's that's the step that goes further and creates the intersectional part of it. It's not just having the right, but having access to it. So I guess maybe what in the post-Roe era, what changes to reproductive health care would you say you've seen, or what do you feel might be the most important fights for the country as a whole?
Right. So, as we know, Roe versus Wade, we just had this, well, it should have been an anniversary, right? We just had that this week. And when we just think about just the history of that and like how that was overturned, right? And the Republicans, and how we look at our Supreme Court and who was placed into those seats, and just understanding what happened on a federal level, I think it's important to lay that foundation. Roe versus Wade was in place, and then we also had Planned Parenthood versus Casey, which actually solidified and sustained that abortion rights are protected up to a certain point in time, right? So we had that. And when the Supreme Court ruling happened and it overturned Roe versus Wade, we have to understand that there were states who had trigger laws, right? where of the 26 states, 13 had laws in place that are designated to be triggered and take effective immediately or by quick state action if Roe no longer applies. So you had states like Mississippi, North Dakota, Oklahoma, South Dakota, Tennessee, Texas, Idaho, all these states who had trigger laws, so that as soon as the protection was taken off on the federal level and given states the right to make that decision, those trigger those states immediately, right? So down south, like when you look at the map, there is a website. I can't think of the name of it, but you can look at a map of what abortion services where they're available. And when you look at certain places down south, like literally in Mississippi, like you look at the states around it, no one has abortion services or abortion rights that are happening in those areas, right? So what you're going to see happen now is that what happened before Roe versus Wade came into effect, underground abortion care services happening. It was a thing. It happened throughout the country where women were going underground to secret locations and calling different numbers and to have abortions. Like people will go great lengths to do it, right? So it's a healthcare, it's a service that should be covered because it's health related, right? So now you have people who are going to do anything to get rid of their pregnancy, and then now have to be faced with death, healthcare problems, complications. So post-Roe, we're not gonna know what's happening unless we're tapped in, but I'm promising you that it's happening, especially down south where this underground network is being created to provide people with services, and it may or may not be the best situation to do it. And that's the scary part, right? In regards to when we think about like abortion access and care, especially down south, like it is scary. And when you think of those states, all of them have the highest infant mortality rate. So when we talk about Black maternal health care, those states have the highest rate. So there's like a correlation to like abortion access and care to Black maternal health care rate. So when we talk about intersectionality, we're talking about exactly that. Like Mississippi, like I keep talking about Mississippi, but like, but I really talk about them because they're like, when you talk about Roe versus Wade, you have to talk about Mississippi because the Jackson's Woman Health, the only abortion clinic known as the Pink House, which even challenged Roe versus Wade in the first place for it to even get to the point where we overturned it, was in Mississippi, right? Mississippi had dozens of clinics, right? But then by time like 1996 or sometime like early 2000, they were the only clinic. They strategically closed down clinics in Mississippi so that women did not have access to abortion services. That Pink House moved all the way to New Mexico. When you look at the map and see Mississippi and where New Mexico is, like, listen, I'm like driving to Dover. Like, I'm like going from Mississippi to New Mexico. Like, that is like a lot of barriers just to abortion care and access.
Exactly. Yeah. Yeah. Well, it sounds like the fight is different in every state across the country, right? After that, there's the states that had those trigger laws, and then there's the states that, still retain the rights and still do that. But, overall, I mean, I think the whole idea of it being accessible is so far from it in certain states like Mississippi. It's like we can't even have the conversation about accessibility because it's like they don't even have it. Yeah.
Mississippi's done deal. Like,
but so basically, like, you kind of did sort of talk about this, but like, why is it essential to have things like affordable and accessible abortion services? Like, why is it not safe to have like these underground situations that may be happening in other parts of the country? Why would that be like very important, right?
No, I believe in the very basic one of right of like being able to have children if I want, not have children, and then parent in ways that are healthy and safe, right? I believe in that very basic principle. So for me, that's why abortion services matter, right? And then two, we know that abortion services existed forever, right? When we talk about the history of abortion, it existed. Like, there are like accounts of like in the Bible of people recapping or like considering like that was an abortion, like that happened, right? So the attitude about abortion in the beginning of times is not the same attitude that we have about it now, right? Where it's a very controversial thing, right? It wasn't until there was an attack on the medical system, which was ran by white men. It was an attack on midwifery. It was an attack on women right? And how we gave birth, where white men took over this healthcare system and started making decisions about women's bodies and how we should receive medical care, right? Which then today equals to why there's high disparities for women in general. But then when you look at race and break it down, it's even higher for Black women or Hispanic women or Native American women when we look at those numbers. So I think it's really important to understand that early abortion laws, like it was an acceptable thing that always existed, right? And that we are using a lot of our Christian-based values. We are using a lot of our logic, and people are using their own personal beliefs on like religion most of the time in our country, in our politics, which we're supposed to have religion separated from state. So that's another reason why I think abortion services should be covered. It's not about if I think what you're doing is right or wrong, right? It's about you having, I might not agree with something, but I also think that people should have access to that thing, and it shouldn't be barriers if they make that decision. So when I talk about like abortion services, like I just think it's a fundamental right. I think people should have it. I don't think religion should be in the decisions that we make in politics about people's everyday lives. Who are we to force someone to have a baby? Who are we to force someone to parent a certain way? Like those things are like, I think just very fundamental of like what America is supposed to be built on. Our founding fathers supposed to have came together to create this great nation, right? Of freedom and liberation. But are we really practicing those things, and what does it mean? So when I think of that, like that's why it matters. And then it's connected to other RJ work. Like we talked about Black maternal health care rates. States that don't have abortion services or have very restrictive abortion laws, infant mortality rates are high. Black babies are dying at higher rates there. So there's a correlation and there's a connection between that. And we have to see that.
Yeah. Absolutely. And I think like what you said basically is just that it's essentially unsafe and really hard to do, like to have those services not be provided in a state. Like it would be unsafe for someone to go out of their way, I guess, to get one without having the correct services or correct accessibility to it. So basically, I guess it would be helpful to kind of, since you already sort of talked about like the country as a whole, and like so much of it is so different post-Roe, what is like, how would you describe maybe what is going on in Delaware with the state of reproductive health care? You sort of said it earlier, but I think it would be helpful to like talk about what maybe we've done and then like what we got to do moving forward, and maybe even some of the work that you've done with that.
Right. So yeah, and I didn't realize this, and I think some people understanding like how government or politics work, but there's like federal laws, right? And that all states have to follow federal laws, and then there's state laws. Each state can make up their own laws. So specifically for the state of Delaware, we had a trigger law, but they voted it out. I learned this from Nick Beard. She is like the GOAT on like all abortion stuff. So she explained that there was a trigger law, and she was one of the, part of the group to help get rid of the trigger law in Delaware, right? So we have a history of one doing that. And then we have a history of protecting it in our laws, that abortion is a protected right, right? But we can take it a step further. And then, we had another legislation that passed where it expanded the type of medical provider that can provide abortions in the state of Delaware.
Right.
So that passed last year. So that was really cool. But so I feel like, and then when Roe versus Wade overturned, our Attorney General, Kathy Jennings, she responded in a way that I thought was very powerful and courageous. She decided to look at ways to protect people who were coming here to get abortions, because in other states, they're like, if you go out of state and have an abortion, you could be penalized for it. Like I'm not even in your state. Leave me alone, right? Right. So finding ways, and then creating like this hotline so that someone can call. If they have any questions about getting abortion care here in the state of Delaware. Right. I think that's powerful in what she did, and being able to create that, and then having lawyers and attorneys available to help protect people. Like that was a big deal for the state of Delaware to do. I don't know how. I don't think many states did that. And our Attorney General did that. And then we already had a history of protecting abortion, getting rid of trigger laws. And I know this year we're fighting for HB 110, Medicaid reimbursement, Medicaid coverage for
Yes.
abortion services. And then it will be even better if we can codify it in our Constitution. The codifying of it means it makes it harder to change. But the abortion rights or services we have here in Delaware, they can vote it out if they have enough votes. But once we put it in our Constitution, it kind of is like permanent. Like it's going to take a lot to remove it out of our Constitution. So I think that Delaware is moving in the right direction when we talk about abortion services. But I also know that even within that, there are some things that we can do better at, right? Like right now in the state of Delaware, like we don't have a lot of abortion providers or services, right? So when we look at that, we need more, right? Planned Parenthood is like pretty much it. Like I know a lot of people will have to go out of state because the appointments might be booked or backed up, right? Those type of things are like what we're facing. It's more about not access here, but eliminating those barriers. And another way we responded was the First State Abortion Action. What is the First State Abortion Fund?
Yes.
So we created. We've never had an abortion fund. So that was the first abortion fund in the state of Delaware. So like Delaware, like if I'm very critical of our state and our politicians and elected officials, what they do. But when I talk about abortion in Delaware, like I think we have been moving in the right direction. Like yes.
And yeah, I mean the direction we can, even get closer to getting like more positive, whatever the next direction we take that's even more positive can be like something like HB 110. So that's what I meant.
Yeah, that has to happen.
Yeah.
Like, that has to happen
this
year.
Absolutely. And so I guess this kind of goes into like what you're sort of asking and what I'm asking, which is how we can kind of work towards achieving this accessibility, right? Removing these barriers in Delaware for individuals to make their own decisions that fit their best needs, like based on that. So like what would you say is like what we need kind of right now?
Yeah, we definitely need insurance coverage, Medicaid and private insurance, right? We need Medicaid reimbursement. If we could do the constitutional amendment, that would be really dope. I know Ohio did it. And what was really cool about Ohio, though, they have referendum votes, right? So we don't have that here in Delaware, which boo, boo, boo,
I know,
boo, 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 right? So referendum votes allows for the community to vote for something to happen. Like in New Jersey, I think that's where they voted to have the legalized marijuana. Like the community made that decision. They came out and voted. They did the same thing in Ohio. I think it was legalizing marijuana. It was something else and an abortion care. People came out and voted, and majority of the state was like, we want abortion care to be a protected constitutional right here in the state of Ohio. Like that right there is what I think Delaware should do. Like it should be like I think the community should make the decision, right? I think each state should do that. I think when Roe versus Wade was overturned, if I was a legislator or a judge, I would have been like, okay, if we're going to overturn it, at least let's mandate a referendum vote in each state and let the people vote. Let the people make the decision. Like that's the decision. Like that would have been better than completely just like, you know what, we're just going to leave, because most politics is old white men who are making decisions for a diverse state of people. And for women, for black people, for brown folks, for poor folks, you have people who are not even relatable to the general population making decisions for us. So that's who the federal government left all decisions to. Like, like make it make sense. Okay.
Quite. But yes, like you said, basically the insurance Medicaid funded coverage is that main push that we're hoping to kind of do this year in Delaware specifically. And that basically is through HB 110. So I'll explain a little bit just like, for people watching and stuff like that. But basically HB 110 or HS1 at HB 110 ensures, I know, substitute. Yeah, ensures that people on Medicaid, private, state insurance plans basically are able to access abortion care without financial burden. And a lot of that that you talked about, all of that funding abortion care through like insurance coverage helps break down some of those like socioeconomic barriers you were talking about, right? Like addressing some of the disparities that exist in Delaware specifically with reproductive health.
And so I will put something in the little comment section for our action form that we're hoping to send. Basically, just kind of you fill it out and it gets sent to the Joint Finance Committee, because we're hoping to have this bill funded through the Joint Finance Committee. So legislators who are on that committee will receive that message action when you fill it out. And then there's other ways to get involved through like our website and stuff like that as well. So I want to let you kind of do like last thoughts on what you're thinking. Like what do you want to talk about in terms of reproductive care, especially just specifically in Delaware?
Right. Yeah. I just think it's time for people to mobilize. I think it's important for like organizations like myself, yours, and other people to educate, right? To give people the information that they need so they know what to do. Like you can join. I don't know if you can join virtually for the public finance, the meeting.
Yeah.
You can. Okay. So you can join virtually. So you could be home cooking dinner for your kids, or if it's during the day at work, and you can listen in, make a comment, like come out.
Yeah.
Like we have to have community pressure on our state legislators to make the right decision. Like you guys have the power, and I don't think a lot of people realize that there's a power in your voice. And then collectively, if people come out and say, yo, we want abortion services to be covered,
right,
this is important to us.
Yeah.
We need you guys to do that. And I know that once we have all the information, I'll share like the link for people to be able to join and participate. If you can come in person, come in person. It is in Delaware, in Dover, Delaware. So yeah, I'll make sure I share all the information and get people to come out. If you can't do that, then there's a letter campaign that's happening to sign, and it will go to our legislators to say, please support this, right? We want Medicaid insurance coverage for termination of pregnancy for abortion care. Like this matters to us. So we have to hear from you. Like that's my closeout. It's like we have to hear from the community. The same advocates who keep coming out, our voices become diminished in the grand scheme of things, right?
Right.
So it's really important for new voices and for the community to come out to voice why they want this to happen. Or if you don't want that to happen, I'm all for whatever you know, exercise your right.
Yeah, absolutely. And like we're having this conversation this weekend, and we're doing it kind of in light of what would have been the anniversary of Roe. But these meetings for funding will happen in February, kind of in the next few weeks. And so not just this week for pressure, like we're hoping, we want people to kind of come out and stay active regarding all of this in the future too, right? Like in the next bunch of weeks. So yeah, absolutely. Well, thank you so much. I really appreciate it. Thank you for kind of giving your experience personally. I don't want to cut you off. So if you have anything else to add, I really want, this to be you. But
get involved. Follow Black Mothers in Power. We're on Instagram, Facebook, and Twitter, LinkedIn, our YouTube channel. Check us out. We have doula training programs. We have doulas who will help support families who are getting abortions or who plans to keep their baby or whatever it may be, whatever the circumstances. We have support at Black Mothers in Power for postpartum parents. We have support for Black men. We have a Black male group that we partner with to provide services. So like check us out, hit our link, contact us. And I just want to say thank you for having me on here. This is an important conversation to have. I want people to get mobilized and involved and like really use your voice.
Yeah, absolutely. And thank you for taking the time and explaining, talking a lot about basically the intersectionality of the issue, that basically what HB 110 really is centered around and hoping to create more accessibility for. So thank you. Really appreciate it.
No, thank you guys. And thank you everyone who tuned in. Thank you.
For sure. Have a good evening, everyone.
Have a good evening.